Well, certification is a mark of distinction. It tells your colleagues, your patients and families, and your employer that you've gone the extra mile to get the knowledge, skills, and ability to care for some really complex patients. Things change so rapidly that you really need to stay current with all the changes that are happening at a very rapid pace. Things that we were doing 5 years ago are not even current practice today. So becoming certified and then maintaining your certification and having continuing competence helps you to practice at the top of your game. Start on that journey. Find a mentor or a study buddy, someone that's going to hold you accountable to set the date for the certification, and then perhaps study along with. Take a review course together. But really, the act of starting on that journey is the most important, taking that first step.
Employers now are looking for nurses to have the extra credentials and maintaining that certification. It could be a distinction between one candidate and the next.
What benefits do hospitals get from having a staff that is certified?
For many hospitals that are on an excellence journey, such as Beacon or Magnet, that's one of the criteria. Many organizations that are on that journey provide incentives and resources for nurses to become certified. And not only the initial certification, but to maintain that certification. And that's all part of creating that culture of excellence where a nurse is on a lifelong journey of learning. As we move towards a value-based care, it is going to be so important that the nurses really have the knowledge, skills, and abilities to care for their patients.
So what are some of the biggest barriers to nurses?
Fear of failure is probably the biggest concern that I hear. And one of the first steps that you can take is focus on the positive.
It's just like with a lot of things. It's a confidence builder, but it's lack of confidence that stops us sometimes from taking that first step. Now tell me about the challenges faced by advanced practice nurses in practicing to the full scope of their authority.
Boy, that's a tough topic, but I will tell you that every state Nurse Practice Act is a little bit different, so there may be state barriers as well as hospital bylaw barriers. One of the ways advanced practice nurses can overcome that is know what your Nurse Practice Act says and work within your state nurses association to help to change them. And the same thing is true for the local hospital bylaws.
Well, thank you so much for coming today. Is there anything else you would like to share with our nursing audience?
I want to, first of all, thank you for all you do to keep our patients and families safe. And if you're already certified, thank you for going that extra mile to become a certified nurse. And if you're not certified, please get on that journey